This is a presentation on attention deficit hyperactive disorder, also known as ADHD, by Ashlyn Ritzema. This presentation is going to go over 5 main topics that are going to be surrounding attention deficit hyperactive disorder. We're going to be talking about who does ADHD affect, indicators of someone who possibly has ADHD, treatment plans and intervention, educational supports and inclusion, and collaborating partners. We begin by asking ourselves, who does ADHD affect? Research has shown that ADHD affects both boys and girls. We have seen typically that boys are more likely to get diagnosed because they show the symptoms more externally, while girls show the symptoms more internally. ADHD is a chronic disease, so it will never go away. Generally, people are diagnosed with ADHD when they enter school. This is because the symptoms are easier to recognize in a school setting than in a home setting. Indicators of someone who possibly has ADHD. One of the symptoms of ADHD is inattention. Symptoms of inattention include a short attention span, easily distracted, trouble organizing tasks and possessions, avoid tasks that require sustained mental effort, overlooks the details, and misplaces or loses things. Another symptom of ADHD is hyperactivity. Symptoms of hyperactivity include trouble sharing or taking turns, constantly talking, oftentimes talking too loud, impatience, moving when inappropriate, fidgets, restless, and inability to sit still. This is one of the last indicators of someone who has ADHD. The symptoms are similar to inattention and hyperactive, but they are slightly different. So someone who suffers from impulsiveness may talk excessively, interrupt others, blurt out answers without waiting for the questions to be done, and have difficulty waiting or taking turns. In regards to treatment plans and intervention, there are 2 main things that can treat ADHD. 1 being medications, and 2 being therapy, specifically cognitive behavioral therapy. So in regards to medication options for ADHD, there are 2 main choices. This is the first choice. It's a methylphenidate medication. These are stimulant-based. They are an immediate release formula. And they increase the amount of dopamine in your brain. The most common form of a methylphenidate medication is Ritalin. The other medication option is a dextroamphetamine-based medication. This is a slower release compared to methylphenidate. Dextroamphetamine enhances the amount of dopamine and norepinephrine in your brain. The most common or the most generic named drug of this is Adderall. Most commonly, people take Adderall XR, which is a 10 to 12 hour. Another option for ADHD treatment or coupled with medication is cognitive behavior therapy. CBT is a short-term, goal-oriented form of psychotherapy that aims to change negative patterns and negative ways of thinking into more positive mindsets. People with ADHD often suffer with super negative self-talk and negative thoughts about themselves due to their inability to complete tasks successfully or complete them in an appropriate time manner. So people will enroll in cognitive therapy, behavior therapy to help with those symptoms. A lot of the extra support that you're going to give to a student with ADHD is also support that you should be just using generally in your classroom. So lots of structure, help organizing their thoughts with graphic organizers, things like that. Lots of encouragement, having fidgets and flexible seating available, and then using positive reinforcement to help students comply with expectations. All of these are going to make your students with ADHD feel more included, and also your students in your just general education feel much more included. In regards to collaborating partners in ADHD, people with ADHD typically are diagnosed with other mental illnesses such as anxiety or depression due to the negative nature of their self-talk. And some of your collaborating partners might be a behavioral therapist, so the child's cognitive behavioral therapist, a psychiatrist, and their parent figures. You should be working closely with all of these people if you are developing an individualized education plan.
Created using Powtoon.